Hello, everyone. I just want to first thank everyone for joining us today during Donate Life Month to talk about the importance of self care and navigating really difficult cases while working with families through the donation process. My name is Lindsay Romeo. I'm a Tissue Family Services Coordinator, and I've been with the Living Legacy Foundation for 3 years now.
Hi, everyone. My name is Maggie McKay, and I am also a Tissue Family Service Coordinator. I've been with the LLF for about 3 years as well. Lindsay, I'm so glad that we can touch base today and talk about the value of taking care of ourselves, especially over this past year, navigating everyone's new normal with this global pandemic.
Me too, Maggie. The healthcare field, including OPOs and hospital partners, have had to continue the great work of honoring donation through the gift of organ, eye, and tissue donation, all during this COVID-19 pandemic. While we often think of our donor families first, it's important to take a step back every once in a while and to check in with ourselves. I know for me personally, it has been really challenging to see so many families not be able to be with their loved ones in the hospital due to the COVID-19 restrictions. And in addition, many of these families haven't been able to have the funerals and services that they would have liked to honor their loved one. And, this can now really delay, and the delay in mourning, it can complicate grief moving forward.
Yeah, and that's been hard for me as well. So many of our donor families have not been able to receive the familial and friend support that they previously would have prior to COVID-19. In addition to our concern for our donor families, COVID-19 has added many additional work responsibilities and challenges. Our clinical teams who are interacting with donors and donor families have had to consider their own exposure to COVID, as well as ensuring that they have the proper PPE to stay safe. I know that our donor services center coordinators were inundated with an influx of referrals due to the rising number of COVID-19 deaths. Outside of our work responsibilities, COVID-19 has definitely played a role for all of us, whether we've been directly affected by the virus, lost a loved one, caring for our children, and working, and not being able to see our friends and families. This can affect our roles at work, too.
It has been a trying year for the entire healthcare field. I think whether we're working amidst a global pandemic or just within our regular work schedules, healthcare workers and mental health professionals are always at risk for certain things like burnout, compassion fatigue, and secondary trauma. And burnout specifically refers to the emotional, physical, and mental exhaustion caused by excessive and prolonged stress. Burnout tends to accumulate over time, and it's generally connected to our work conditions. This can include feeling like you have little to no control over your work, lack of recognition for your work, overly demanding job expectations, or working in a high pressure environment. I know that I've experienced these things at times, and I can imagine many of our colleagues and community health partners have as well. And these feelings are not necessarily uncommon, which is why it's so important that we talk with our supervisors and managers as these concerns arise, because letting these feelings build up can present more challenges down the road.
Wendy, I'm so glad that you brought this up, because oftentimes as helping professionals, we always put others first. But if we aren't recognizing our own struggles and limitations, it ultimately will affect the quality of our own work and the care for our donor families. If we aren't taking care of ourselves, we won't be able to help others. And this holds true in our personal lives as well. Working with death and dying every day can undoubtedly lead to feelings of compassion fatigue and secondary trauma. First, it's important to remember that the work that we do every day is not the world's reality. While we see death and dying every day, and death is a fact of life, it's not as commonly experienced as we see in our day-to-day work life. Secondly, when we are exposed to prolonged trauma, we are at a risk for compassion fatigue. which is the natural consequence of stress resulting from caring and helping for traumatized or suffering people. During these moments, it can be extremely helpful to check in with our colleagues and express how we're feeling. While saying that, we want to be careful not to one-up trauma stories and more so explore why the specific case is resonating with us and what could be helpful for us in that moment.
I completely agree, Maggie. We need to be very cognizant of how we share details of difficult cases to avoid that cycle of secondary trauma. Secondary trauma is characterized as indirect exposure to trauma through a firsthand account or even a narrative of a traumatic event from one of our colleagues or from someone else. Symptoms can include unwanted, upsetting memories, nightmares, flashbacks, even a physical response to these trauma reminders. After, discussing these potential risk factors, it's vital then to focus on what we can do to help ourselves and our colleagues. I think a great place to start is just touching on our work and personal life balance. Separating work and personal life is an easy enough concept. However, many people have trouble actually implementing it. Employees of our organization, the Living Legacy Foundation, have expressed having trouble being off work, but still thinking about those difficult cases and wondering if you did enough. We all need to remember that when we sign off and turn over our responsibilities to the next shift, that we can trust our teammates and keep in mind that we all have the same goal.
Yeah, and I know for me at the end of my shifts, especially with the ones that have particularly difficult cases, it can be hard to transition back to personal life. Working remotely has its own challenges. When working in the office, I used to have that drive home to decompress. Now, just walking up the stairs, it's a little different. Sometimes I end up needing to take my dog on a walk or trying to get in a quick exercise. But after a shift, I also have to be mindful of what I'm exposing myself to. We should all consider what type of news, TV, books, and other material we're taking in, and how certain information can compound the trauma that we've been exposed to during our workday. For example, I used to love watching Dateline, 2020, all of those crime podcasts. But I've noticed that this sometimes is too much after dealing with those difficult cases. I've had to make a shift and lean towards more lighthearted material following my workday as an effort to decompress. And as a reminder that the frequency of what we see in our everyday work life is not our reality. I also have to make an effort to get more sleep in between shifts, as a lack of sleep can lead to mood changes, trouble concentrating, and even decrease our immune system.
That's a really great idea, Maggie, and definitely something I'm going to be putting into action for myself. I feel similar at the end of a difficult shift. And particularly, I need to work on getting better sleep myself. I think that's all something that, at the LLF we can struggle with. Mm-hmm. It's essential that we take care of ourselves throughout our work shifts as well. And this can help easing our transition from work to then our personal life. A few basic things we can do is just making sure that we are eating, that we're taking bathroom breaks, washing our hands, taking deep breaths, and checking in with our colleagues who we're working alongside with that day. This sounds easy enough, but we all know the days can get away from us and we tend to put ourselves on the back burner. One thing I've just started doing is setting an alarm at the beginning of my shift for every few hours to check in and ask myself a few questions. Have I eaten since I've started working? Have I been able to sit down or stand up? Do I need to take a moment and take a deep breath? And does my partner or colleague have a moment to debrief? That last question is particularly valuable as we can't always debrief with our families due to confidentiality and the HIPAA requirements that we all know. We don't always realize why a certain case or shift is troubling us, and having a colleague to confide in can help us understand our own triggers, based on our backgrounds and personal experiences, and that's either from work or from our personal life.
Lindsay, I'm so glad that we've been able to get together and have this discussion today. Self-care is truly such an important part of being a helping professional. It's also important to remember that self-care doesn't have to be going and getting that 1-hour massage. It can be a quick check-in with yourself. A few things that I try to do on my busiest of days is taking those deep breaths, focusing on my body posture, rolling my neck and shoulders, and engaging my 5 senses. So I want to take this moment by checking in with ourselves. Finding a comfortable position, rolling our shoulders back. And now let's just take a quick deep breath in through our nose and then out through your mouth. I'd love to end today with a brief quote that was shared by one of our colleagues last week. Gaber Mate said, "When people face death, they come up against the truth of their own lives. If you can face death, you can face life." Thank you so much to everyone who took the time to be with us today. And as a final reminder, be gentle with yourself and remember why you do the work that you do. You are changing lives for the better every single day.